Well, good afternoon. I hope the media likes this new location, but I think we're going to do this every day here in Eastern Market. Let me update you on what's happened in the last 24 hours. With me are Kevin Johnson, the head of the Detroit Economic Growth Corporation, and of course, you're familiar with Denise Fair. We have now approached 2,000 tests done at the State Fair drive-through testing site. It continues to perform remarkably. We'll have close to 700 done today. And we have the capacity to go up to 1,000 a day. The issue has been test kits, but Senator Debbie Stabenow just called, and she says FEMA has 200,000 swabs in a truck headed toward the state of Michigan. So when we receive the 200,000 swabs, I think we'll be in a position to go up to 1,000 tests a day. And we're already starting to have conversations with some of the suburban police and fire departments about making sure that we can get their police, firefighters, and EMTs in as well. My first priority is to make sure that every single resident of the city of Detroit that is showing any kind of symptoms can get a doctor and get a test. Yesterday at 3 o'clock, I asked the physicians in this town who were willing to take new patients to please contact us. And in classic Detroit fashion, the response has been overwhelming. 22 separate doctor's offices have reached out to us in the last 24 hours and are ready now to take your call. If you don't have a doctor, these 22 offices will take you. Our folks are updating the website right now. They were coming in so fast that it may be an hour or so before the website is up to date. But for those of you familiar with your area, let me just tell you who's participating. If you're on the east side of Detroit, the Detroit Community Health Connection is taking new patients at both the East Riverside Health Center and the Dr. Sophie Womack Health Center on Kercheval. The Wellness Plan is taking patients on their East Medical Center campus and East Outer Drive. The Health Center Detroit Medicals Group is taking patients at their East Jefferson Health Center, and the Popoff Family Health Center over on the east side is also taking patients. On the west side, Detroit Community Health Connection has the Dr. Wilson Health Center on West Warren, the Woodward Community Health Center on 611 Martin Luther King, the Noland Family Health Center on West 7 Mile, Health Centers Detroit has the Greenfield Health Center. The Wellness Plan has the Gateway Center on West Grand Boulevard and the Northwest Medical Center on Greenfield. The UHC Center at the Detroit Medical Center on St. Antoine and CCIH on Peterborough. In Southwest Detroit, the Chaz Center will take you on West 4th Street, and the American Indian Health and Family Services of Southeastern Michigan will take you on Lawndale. In addition to that, Dr. Richard Brown and the Park Medical Clinics, who have 7 different clinics across the city of Detroit, are all taking new patients. As I say, in the next hour or so, all of these clinics and their contact numbers will be up on the city website, and so you can find them. And if you have any trouble getting a doctor, Denise Fair's number is on there at the Detroit Health Department, and they will get you connected. Some of these practices are only taking patients who have insurance, including Medicaid. Most of them will take you whether you're insured or uninsured. So you should have a doctor anyway. There is no reason anybody in this city shouldn't have medical care. Most of these clinics will take you if you have no money and no insurance. They're there for you. So pick up the phone and call tomorrow, and if you need a test, they'll evaluate you. They may even evaluate you over the phone, and potentially you can get a script and then you can come out to the fairgrounds. We also had a number of transportation companies call yesterday. We're going to work out contracts with them in the next couple days, and I hope by the end of the week we have a means for you to have free transportation. But at least right now, the doctors in this community are wrapping their arms around the citizens, and they're willing to take you. 22 centers waiting for your call today. An update on public safety. The Detroit Police Department, as of today, has 76 members who have tested positive for COVID-19. The Detroit Fire Department has 17 members. The Police Department has 522 officers who are off on quarantine, but 203 in the process of being returned. And the Fire Department has 133 officers on quarantine. This afternoon, I think just about every quarantined officer in the Detroit Fire Department, if they have not already been tested, are being tested at the Fairground Center. Tomorrow, every police officer who has not been tested will be tested at the Fairground Center, in addition to several hundred citizens of this community. Yesterday, I was extremely pleased to announce that Greektown Casino had stepped up and offered free hotel rooms for our first responders who had family members at home that they did not want to go back to and potentially infect. And it's almost overwhelming what we're seeing in this city, because today we had a group of partners who stepped up and are offering free childcare, daycare services for our first responders 5 days a week. Bright Horizons, which has a daycare center on Seward in Midtown Detroit near Henry Ford Hospital. They've partnered with Ariana Huffington, the Harvard School of Public Health, and CAA. And there are now 40 slots for children of Detroit police officers, firefighters, and EMTs. You can take your child to the daycare center Monday through Friday from 6:30 a.m. to 6:30 p.m. And you just have to enroll like any other daycare center. Again, the information will be on our website, but if you call the number 313-871-2000, you could get enrolled today. You could potentially start to take your child to daycare tomorrow. And this group is offering free child care for the children of first responders as long as the pandemic continues. It is really special to be mayor of the city right now. Most of the phone calls I am getting are people making extraordinarily generous offers to pitch in and help. The final thing that I want to discuss today is what Kevin Johnson has been working on for the last 2 weeks. And it is one of the most powerful programs I've ever seen to help small businesses. We've got a lot of small businesses in this town that when we come out of this pandemic, if we're going to be a vibrant city, we've got to save them. We've got to keep them going. And through no fault of their own, they've still got rent bills, they've still got utility bills, they've still got a range of costs, then they could go under. And so with the great support of Council President Brenda Jones and the Detroit City Council today, Kevin Johnson has put together a $3.1 million fund for grants to businesses as a COVID-19 relief fund. They are grants for businesses between $2,500 and $10,000. And if you are a small business in this city that made less than $1 million last year and had fewer than 50 employees, you can apply for this grant program starting at midnight. And whether you get a $2,500 or a $10,000 grant depends upon how much money you've lost, how many employees you've had, how long you've been in the city of Detroit. And we will have the first checks out to businesses within the first couple of weeks. And so to give you the details on how the program works and how you as a small business can apply, I just am so proud of him. So let me turn this over to Kevin Johnson, who put this whole thing together. Kevin?
Thank you, Mayor, and I appreciate the opportunity to share this wonderful news. I also want to reiterate that with the leadership of Mayor Duggan, City Council, and City Council President Brenda Jones, the Economic Development Corporation of the City of Detroit, as well as my team and partners at DEGC, we were able to craft together what we think to be a very impactful and innovative approach to trying to sustain and stabilize the small businesses that are here in the City of Detroit. What you can use the dollars for are things such as payroll, rent, mortgage payments, and utilities that are the pressure points for small businesses when they're under this type of enormous circumstances that they're trying to face. So we want to direct the money to the places that it can give them the lasting amount of impact to sustain what we're this very devastating economic times that we're in. I do want to say a bit about what we could, how we're going to score these opportunities. One is, as the mayor alluded, the idea of how long businesses have been in the city of Detroit, the profitability of the businesses, the number of employees are important because we want to make sure that the least of the small businesses have the best shot at sustaining themselves moving forward. You will also find on our website at midnight the way you can apply for these resources. I think is important, and we are ready to stand and help with technical assistance to walk you through the process. We don't want the process to be onerous. We want to be able to get dollars in the hands of the people who need them the most, the fastest. So there is a process, and you will find all the criteria on the DEGC website at midnight tonight. With that, Mayor, look forward to answering any questions that you all may have.
So, Kevin, is this first come, first served? Do they need to be right up at midnight to fill this out?
No, sir. They do not have to be first come, first served. We wouldn't do that to you. Just want to let you know when it would open up. All right. But yes, we want to be as efficient with what we're doing as possible.
We continue to get hit with tragedy every day, and was very sad to see Dr. Vitti announce that we lost 2 members of the Detroit public school system. The death toll continues to climb. We're continuing to lose our neighbors, and the number of positive cases will continue to grow because our testing is expanding, and I expect our numbers will grow faster than others. But it is so urgent. I don't know if you've seen the video from New York. They're setting up these field hospitals in Central Park. I mean, that's what they have to do to prepare for the surge. We could be in that situation in 2 weeks if we don't keep our distance from each other. It is the only way to fight it, or we will be in the same situation that New York is in. And for an update on the latest numbers, Director Fair will tell you what's happening in the city today.
Thank you, Mayor Duggan, and thank you to Kevin for helping our businesses continue to thrive. So as of today, there are currently 2,086 confirmed cases in the city of Detroit, along with 73 deaths. Now, this represents a 16% increase from just yesterday's count, with the highest demographic between the ages of 40 to 69. Now, I don't take any joy sharing these statistics, and I can only imagine how it feels hearing these numbers day after day. However, I believe in transparency, and facts are so key to helping us slow the spread of COVID-19. Now, the opening of the recent test site at the State Fair grounds, coupled with the mayor's initiative to expand access to testing for first responders, is very key. The more people that get tested, it's really better for us all. And this will dramatically increase the number of COVID-19 cases that we will see in our city. But again, knowledge is power, and I will continue to repeat myself every day and encourage everyone to practice thorough hand washing and cleaning high-touch surfaces often, making sure you're covering your coughs with a tissue or sleeve, and staying at home, avoiding unnecessary trips, and keeping your distance from each other at least 6 feet apart. We are all looking forward to the day when COVID-19 is behind us, but that day is a ways out. So until then, let's take this seriously. This is our responsibility. We need to take our part and take care of each other and those that we love. Now, the Detroit Health Department is here for you with the City of Detroit, and we are available 24/7. You can call us at 313-876-4000 or email us at dhdoutbreak@detroitmi.gov. If you need a doctor, you can always call us as well. Please visit our website for the latest information. And finally, I'd like to personally acknowledge all of those who are on the front line. Those are our grocery workers, our gas attendants, our food distributors, those who are working so hard for us every day to ensure we have what we need for our health and our well-being during these difficult times. Thanks.
All right, with that, we'll take any questions.
From reporters who are watching remotely. This could be for Kevin, wanting to get some clarity on the Motor City Match COVID-19 business assistance. This is from Crane's Detroit Business. Is that only open to Motor City Match and Motor City Restore participants, or is it open to anyone?
No, this program is citywide. It's not specifically for only Motor City Match and Restore winners. It's a citywide program. We do, however, are working really hard to make sure that those awardees are as stable and stabilized as we can, but this is not specifically just for Motor City Match and Motor City Restore awardees.
Okay.
Any business that in 2019 made less than $1 million or had fewer than 50 employees in the city of Detroit is eligible, and you should go on the website sometime after midnight and fill out the form.
Okay, and the second part of the question was, what does that mean if this money is being used from those programs? What does that mean for the operation of those programs? Are they on?
No, it doesn't take away from those programs. This is new funding. So this program is coming from money that the city gets paid out of casinos and some other EDC funds. So this is in addition to Motor City Match. If you're a Motor City Match winner and you made less than $1 million last year, you can apply for this. If you weren't a Motor City Match winner and you made less than $1 million last year and 50 fewer employees, you can apply for this. Doesn't affect Motor City Match.
Okay. Question from a couple of reporters wanting to know regarding the TCF Center, if the city is involved and if there's anything you can speak to that the city may be doing.
The city has been, and I've been from day one, 100% supportive of the field hospital at the TCF Center. I know it may bother some people, but the safety of our citizens and the health of our citizens is the highest priority. The Army Corps of Engineers is doing a great job in coordination with the governor to set up that field hospital. I hope we don't need it, but if we do, we can surge an additional 900 beds, and if things don't change in the trend lines, it may be needed, and so I'm working in full partnership with the Army Corps and the governor.
Okay. Question from WDET regarding police officers in quarantine. With 200 officers expected to be coming out shortly from quarantine, the numbers are still increasing, correct, as far as the numbers total in quarantine, and do we expect sometime soon for the numbers to be dropping?
The answer is yes. We're still making our staffing and our pullout, and And we're evolving, we're learning, but Dr. Dunn, who you've met before, the medical director for the police and fire department, we started off saying there was going to be a 14-day quarantine. But if somebody has a test pending and it's the 15th or 16th day and the test is not back, Dr. Dunn has taken the position he'd just as soon wait an extra day or two and get the test results. So everybody who has their test results back or is past 14 days and has test results back is being returned. But we expect 200 officers to be returned very shortly, but we're doing this the right way.
Okay. Small detail question. Are swabs and test kits the same thing?
So I can tell you more than I want to know, but basically, so you have a swab and you have some medium that after you take the sample from the nose or throat, you put the swab in the medium to ship it to the lab. In our case, we're using basic saline, so it's not really an issue. But the test kit is considered the swab and the medium together. In our case, we have unlimited supplies of saline. We basically need the swabs.
Got it. And last question from those watching is for Health Director. They're pointing out that our numbers on our website are somewhat different from the states as far as the number of cases and the number of deaths. Is that just because of the time of day that each reports out?
Sure, thank you for the question. So there are two different databases. We pull our numbers from the state, and the state pulls their numbers from us. So we're constant communication with the state. They report at 2 o'clock, and we report at 12 o'clock. So our numbers are going to be a little bit different. But again, as of today at 12 noon, the case number is 2,086 confirmed COVID-19 cases and 73 confirmed deaths.
Mayor Duggan, I'll just start by sending my condolences on the passing of Graham. I know that this has been a tough loss for the city. Just wanted to let you know that. You talked about New York City, looking at those shocking images of tents being set up in Central Park. Is that something that your administration is looking at here in Detroit?
So the expansion of hospital capacity is being done in partnership with the Army Corps of Engineers and the governor's office. And it is a city-by-city thing. So you could see expansions in Pontiac, you could see expansions in Flint, you could see expansions in Royal Oak. And so I am working with them on any site they possibly want in Detroit. I've offered up several sites that I believe would be ideal. I agreed with them that TCF Center gave us the ability to put 900 beds down at once. And so I support that. I will support them in every single site that they want, but it is driven primarily by the governor and the Corps of Army Engineers.
I know that the Army Corps of Engineers has looked at more than a dozen sites already. Do you see any other facilities, whether it's Wayne State or the Pistons building, any other place in the next few days that could become a field hospital? So
we need to see when this peaks. The state of Washington says it's going to peak on April 8th, or the University of Washington. Okay, I'm skeptical of that number. If it turns out that Bill Gates and the Washington folks are smarter than we are, we may not need any field hospitals. If it peaks April 21st, April 30th, we could potentially need multiple field hospitals. We just don't know. And so what the Army Corps and the governor are doing is exactly what they're supposed to be doing, developing multiple options to see when and where that peak hits. If everybody would just stay home, we won't need these additional hospitals. The virus won't have anybody else to spread to. And we're making a lot of progress, but I'm still seeing images of people clustered together, and it's just so harmful to everybody. But I'm not in the prediction business, I'm in the preparation business. And we are preparing for the worst case, and we're hoping it doesn't get there.
And when it comes to preparation, you talked about 200,000 swabs are on the way from FEMA. Obviously, we expect these numbers to rise as more people are getting tested. What happens next when it comes to testing? What else is down the pipeline or that you're looking at?
So it is hard to overstate the job that Andrew Cuomo has done in the state of New York. They have probably tested 250,000 people. It's just a massive undertaking, and ultimately he will bend that curve down faster because of the data they gathered in that testing. Nobody else in the country has approached that, although I think Michigan is climbing in that direction. But we ought to easily be testing 5,000 and probably closer to 10,000 people a day in this state. We've gone from testing 125 a day 10 days ago. Today, I'm going to guess we're testing 2,000 or 2,500. I'm hoping 2 weeks from now, we're testing 5,000. But you can't test without these swabs, and the priority has been given to the individuals in the hospitals who are most in need. Then they go to testing the first responders and the health workers so that we can keep them back at work, and then to the broader group. And so the fairgrounds is obviously far and away the largest testing site for that next group. And as the lab capacity and the kits become available, I would really like to see next week, if that truck shows up, we'll be doing at least 1,000 people a day at the fairgrounds, and that'll be a good thing.
My last question, I live in Midtown. I go to the Whole Foods on Woodward often. Yesterday I was there, and the fear was palpable. It felt different in there. What do you want to say to Detroiters? As you said, we haven't seen the peak yet. We're a national hotspot. What do you want to say to them right now?
I'm just so proud of the way Detroiters are handling this. By and large, it has been calm. It has been done with resolve. My office is flooded with calls of folks who may be home from work and are told to isolate, and they say, is there a place I can volunteer to do food? Is there a place I can be helpful? It's just been an overwhelming coming together of this community. And if we stick together like that, we'll be through this sooner rather than later. I'm just so pleased at what I'm seeing out of the Detroit Police Department. You want to talk about a group that was rocked by this virus, and now, I don't know if you saw comments in the paper, but the police union saying, we feel good about what's happening. They're taking the officers' temperatures at the start of every shift. They each have 2 masks, the surgical mask and the N95 mask. They know when to use which one. I think we will be the first city in the country in the next few days with 15-minute testing of our law enforcement personnel. People are coming together, and it's going to be a while. This isn't going to be a 1 or 2 week thing. We're going to have to fight this virus day after day for a period of several weeks. And if Detroiters handle the next 4 or 6 weeks the way we've handled the last week, we're going to come through this all right.
Thank you.
Mayor, I have some additional questions that came in. For the doctors and clinics that are accepting new patients that you mentioned earlier, do we know what the cost would be to individuals who are uninsured but need to get a test?
So there is no cost for anybody for the tests. So thank you for that question. If your doctor writes you a script, we do not charge you for the test.
Okay. Because of the rate of testing going on at the state fairgrounds, do we expect to do more than the original amount planned, the 14 or so thousand?
We're way past it now. So we were at 700 today. We had hoped to be up to 500, but it has gone so efficiently. And now, I think many of you know, Dr. Phil Levy had started a testing program at Wayne State University for health workers and first responders. And we're talking now about combining our 2 operations, because the fairgrounds has proven to be such an efficient way to process people. And so I wouldn't be surprised in the next day or two, Dr. Levy isn't joining me at one of these announcements to talk about the fact that the most efficient way to test is in that central location, and it's so easy to get in and out.
Okay, and so just for clarity though, I think the question was more so, we announced that we would do about 14,000 tests over the next 6 weeks at the fairgrounds. Right. Would we be doing more than that?
We're assuming the swabs are located off the truck, we will do a lot more than that.
Okay. Are there any plans initially for additional field sites?
So I know that Wayne, Oakland, and Macomb County would all like to set up their own locations. Your problem is one of testing capacity. The hospitals just don't have the testing capacity. And so I struck a deal with BioReference Labs in New Jersey that is doing a large share of Governor Cuomo's testing. And we've now gone from 500 a day to they've committed now 700 a day. So basically, the reason that we are able to do testing when nobody else can is we went and got capacity out of New Jersey. We got the first results in today from the Friday test. So we're getting 3-day turnaround in large numbers. This BioReference Labs, I think, are just as outstanding a testing group as there is in America, and we're lucky to have them. Now, I'm hoping that there's a point in which New York's testing goes down, and I can go to BioReference Labs and say, can we do 1,000, 1,500, 2,000 a day? Or Henry Ford, DMC, Trinity are all expanding. Maybe they end up taking a piece of it. So that's a long, complicated way of saying we're going to keep expanding that site as fast as our capacity will allow.
Okay, and a clarity question on the cost. So there's no cost to have the test administered, but is there a cost to people for, if you're uninsured, to go to this doctor and get the prescription?
So you need to call the doctor, and most doctors will ask you to pay something. Most of these federally qualified health clinics, if you can't pay anything, will treat you for free. And so you should have that conversation with your doctor, but the vast majority of the doctor's offices on these lists don't charge you if you can't afford to pay. So there's no reason everybody here, no matter what your income is, call and make an appointment. There is a doctor's office on this list that will treat you whether you can pay or not.
Great. Two more questions that should do it, I think. One is, are there any issues with supplies for first responders, such as gloves and masks?
I think we're doing well on masks and gowns and gloves right now. I would say 10 days ago I spent 50% of my time on the phone trying to get supplies. Now I'm spending 20% of my time on the phone trying to get supplies. There's two pieces of that. One is Boise Jackson, our procurement director, is a magician in the acquisition process. But the other thing is that the federal government has evolved from basically taking a hands-off, it's the state's job, to really taking a much more active role in developing supplies. And those two things together are easing the supply problem a little bit. Now, if Florida and Illinois and California explode, it may create enormous pressure on the supply chain of the country. But anybody out there who's got N95 masks, we could still use them. But right now, our biggest issue is swabs. It's the test kits.
Okay. And also beyond, this is another question that just came in, beyond the TCF Center, are there other locations being eyed for surge capacity?
Oh, yeah. I mean, the Army Corps of Engineers is looking at a dozen different locations. And they have my support, whatever building they want, whatever site they want. If they believe it is the right thing for the health of this community, I'm on board. I know they're in a number of suburban locations and a number of outstate locations, and I'm sure every other mayor is saying exactly the same thing. But you need to talk to the governor and the Army Corps about which options they are assessing and under what scenario they would do it. TCF Center was clearly the right way to get 900 beds at once. People are angry about the convention center. The health of the people in this community come first, and that's what we decided to commit the TCF Center right out of the gate.
Okay, last question. For individuals who pass away from undiagnosed COVID, does that get captured later at some point? Are they tested afterwards, after they pass?
Can you repeat the question?
If it was undiagnosed COVID, it's not going to be captured. All right, that's, you go by a diagnosis. So doctors write the cause of death, and we go by that. But there's no doubt that there have been people in this country who died from pneumonia or other things before the physicians realized what happened that probably were under-recorded. But today, the doctors have absolutely no trouble recognizing the COVID-19 symptoms when they come in the door.
Okay.
Anything else? All right, thank you.